US ENT Supplier Spotlight. We are excited, and I always have a ton of anxiety when we touch on this topic of cybersecurity. We've done a couple of these webinars with different professionals over the last several months. This topic has been top of mind for me since I attended a MedTech conference in Houston last October, so fall of 22. And I listened to a panel discussion with some of the participants on this call and some of the attendees as they discussed the vulnerability of, in that conference, they were talking about medical device and medical technology companies, but I easily extrapolated how vulnerable we are in all of our medical practices to cyber attacks. I think most of us have a false sense of security that those kind of attacks happen to big hospital systems and huge companies like our large suppliers in the ENT world. And it's actually quite the opposite, as I've learned. We are perfect targets, um, both at the practice level and at the supplier level. So I just want to tell a little story, and then I'm going to introduce my colleagues. So just on April Fool's Day, when we're recording this, today is April the 11th. So 10 days ago, one of our US ENT suppliers on a Saturday morning, every employee in the company woke up to the wallpaper on their computers being changed to a message from the Lian crime gang, cyber gang in China, that they had seized the entire company's data, including all the patient health information, and they were already accruing substantial fines in the US, and they tallied how much that fine was already had already accumulated. And then they threatened to release all of the patient health information and other sensitive information to the dark web if this company didn't pay the ransom. And they didn't even put the number there. All they showed was how many millions of dollars in fines this company had already accrued. So they left a link to begin the negotiation to pay the ransom for the company to get its own information and data back. That company had great cyber insurance and a team in place. And so they spent 15 or 16 hours April 1st and 15 or 16 hours April 2nd working with their professionals, including some on this call, to quarantine off that threat, to restore their data from offsite backup, and to get back to business last Monday, April 3rd. But that's unusual. As my colleagues from Hylant and others will talk about in the next 20 minutes, the usual case is the company has to pay the ransom, and the company shuts down for a significant period of time, losing all that opportunity and revenue, and then faces an inordinate amount of federal government fines as well as civil litigation from us, the entities not protecting the patient's information. So it is a big deal. And that's why I say every time I even mention the word cybersecurity, it gives me anxiety because we are all so vulnerable to this. Okay, now that I've appropriately scared everyone to pay attention for the next 15 minutes, let me introduce the folks that will actually be presenting. So at that meeting, I came in Houston, I came across Hylant, Hylant. Hylant is one of the largest privately held insurance companies that exist, and they are particularly competent at all manner of risk management and subject matter experts on cybersecurity and cyber insurance. And as we'll talk about, not only is it important to have a key or a critical cyber insurance policy in place, but you have to have partnership with the right people that know what they're doing. And usually, like our colleagues, one of our US ENT suppliers, that was the first phone call they made was to their cyber insurance company to start the process. So Alex Clark is the lead at Hylant. He's the vice president really in charge of all of these endeavors at Hylant. And so he will be presenting the material today. We're joined by several of his other colleagues, as well as Lisa Cox-Ganoom, who's an international cybersecurity expert attorney out of Baker Hostetler in Cleveland. But Alex, with that, why don't you take it away?
Yeah, sounds good. Thanks, Dr. Keith. When we talk about cyber, it's ever changing, it's ever evolving. These cyber attacks come on very quickly, and every time we think we have, a lead on what these bad actors are going to do, it always seems that they're about two steps ahead of us. Dr. Keith had a really good story there, and I always like to throw in a story of my own. We had a cyber claim just recently where, ransomware attack got shut down. One of the biggest things that we promote during a cyber attack is having those good third-party vendors and really having a plan that you're going to tackle and you know exactly what you're going to do. Well, this specific business didn't necessarily have that. Something we had talked to them about, didn't execute it, didn't practice it, and they jumped on Teams just like we're talking today and started talking about their next steps. How are we going to pay? How much are we going to pay? What's our policy going to pay? And those bad actors sat there and listened to that whole conversation. And so then when they started to negotiate with those bad actors, they said, there's no more negotiating. We know exactly what you're going to do. We know exactly what your limits are with your policy. This is what we want, and it changed the whole ball game. So when we talk about cyber risk and cyber risk specifically, there's really three areas that we try to concentrate in. One is the pre-work. What controls do you put in place to protect all your assets and all your data and all your management? Transferring that risk with a very strong insurance policy. We'll talk a little bit about today about how every policy is different, and then really putting the right plans in place, partnering with people like Baker Hostetler that Dr. Keith just talked about, to make sure you know who your partners are, to make sure there's no lag time, to shut these bad actors down, and to stop this claim as quickly as possible. So to start there, really just kind of some statistics to set the stage. So when we talk about healthcare as a whole, healthcare works completely different than manufacturing would, works completely different than the way retail is when we talk about cyber exposure. So healthcare specific, those ransoms that we talk about, the average ransom paid for a healthcare entity is north of $850,000. That's a good chunk of change. If you don't have the proper limit within your cyber policy, you could be paying that out of pocket, along with the fines and penalties and the business interruption that comes with being down due to a cyber attack. So then we say, Alex, we have MFA, we have all these controls put in place to stop these bad actors. Why do we need to be worried about a cyber policy? Well, you could have the best controls in the business. You could be locked down like Fort Knox. But at the end of the day, 80% of these cyber claims are created and driven from human error. So someone just like myself getting distracted when the dog's at the door, clicking on a link that I shouldn't, gives those bad actors access. As simple as that, a bad actor could get into the system.
That's what was scary, Alex, is that with this particular company, they actually had formal training. And I think we all have had it beaten in our heads that we don't open attachments from emails that we don't recognize the sender. But these gangs have become so much more sophisticated, mirroring normal sites that we would visit, even from a business standpoint, whether it's Amazon or Google or something, ordering supplies and not realizing that it's not the actual site, entering passwords. They think, although this company still doesn't know where the breach occurred, but they think it was something as simple as someone sending a meeting invite, a calendar invite, and it looked like a link to reply to the video conference. And they think that was actually the breach. So yeah, can you talk a little bit more about that and maybe what Hylant recommends as far as training employees on what they can click on and what they can't from a company computer?
Yeah, you're spot on. So, and there's a couple ways to prevent that, but we've seen everything from, phishing links or, spoofing email addresses where the two O's in Google have been replaced with zeros and they look exactly like Google. So you really got to start to train that eye. There's really two areas when we talk about controls that we really like to highlight there. One is intentional phishing emails. practice, send your employees those fake emails, making sure they know exactly what to look for. The more you send those phishing emails out there, the more hesitant people are to click on those links. It really starts to train their brain to look and take that extra second. Also, is just email filtering, really making sure we have the right controls and using that artificial intelligence that Google, Microsoft, that they all have to make sure that we're trying to clean out and push away those phishing and artificial links that these bad actors are sending to relatively cheap options that we can take advantage of to really cut down on that human error.
Now, when we talk about insurance benefits, obviously, if you have to pay the ransom, if you have to pay fines, if you have to pay, legal fees for any civil litigation that's brought against the practice or the physician, I guess what is covered under a typical cyber insurance policy? I will insert here that I have had, and my office management is listening in on this call too. We have had an audit done of our cyber insurance. Now, we have a very robust cybersecurity program with our IT company, but this is a little bit different. So this is actually the insurer that helps us navigate a breach. What we learned is that through our med mal practice or coverage, we had a throw-in rider of $100,000. And that was the extent, even recently, of our cyber insurance. As Alex said, the average ransom is over 800,000, and many times it's into the millions. And we all know on this call that that is a substantial amount of revenue for a practice. Our practice has 4 physicians. So paying $1 million ransom and then legal fees and then fines, it wouldn't take much to bankrupt a practice, right? And so I guess that's, Alex, why we need insurance. And if you could provide a little more color on what a typical policy would and wouldn't cover.
Yeah, the layers of cyber insurance and cyber risk go very deep, right? One thing we always like to point out is if you look at your property insurance policy or your auto policy, those have been around for 50 plus years, and in some cases, hundreds of years. Cyber's really only been around for 10, 15 years in the world we know it today. So with that being said, every cyber policy, every cyber insurance carrier is completely different. We got in a very big trend of where your general liability or your malpractice policy would throw in a little bit of cyber and it would give you 10,000 of a data breach attorney or 50,000 of ransom. We really quickly realized that that's just not near enough. Everyone's very expensive. The expertise that these policies provide are very expensive, which means we need to have the appropriate limit put in place. So when we say the appropriate policy, the appropriate limit, what does that mean? We want to make sure that there's the risk recovery piece of it. So those data breach attorneys, forensic experts, public relations that are all there to help walk you through and guide you through that process. Things like business interruption. The average days till acceptable restoration to just get you back up and running at the bare minimum is 6 days. So then you have another 20, 30 plus days to get you back running at 100%. A good cyber policy is going to refill your pockets, per se, get you that money, get you the cryptocurrency to pay these bad actors, but also it's going to help you manage your reputation. Dr. Keith, you talked about federal guidelines and fines and penalties that could be assessed from the government down. We also have to keep in mind that every state has their own laws. So you can start racking them up, whether you have a client or patient in Indiana compared to Connecticut. You have to be able to walk through those and make sure you don't have any trips. A good cyber policy is going to provide you the runway and the tools and resources to comply with all of that.
Yeah, it's such a big thing when you talk about business interruption. Again, just because one of our suppliers just went through this and we were right there on the front row. I mean, they had access to nothing. So when this happens to a medical practice, you can't check your accounts receivable. You can't schedule patients. You can't follow up on any of the lab results and everything that are there. So think about that mushroom cloud. Like, what if you had a pathology report that showed cancer, but you have no record of that for 6.1 days? And as Alex, that's the average. Many practices are shut down for 3 or 4 weeks. So what's the implication to that patient? What's the implication on a delay in diagnosis med mal lawsuit? So it just goes on and on and on. And so it's absolutely critical. Cybersecurity, again, at USENT, we plan to have this topic discussed frequently because I just don't know that any of us are taking it as seriously as we should. It's a big, big deal.
You know, Dr. Keith, you said you used the word supplier a couple different times. And one of the biggest pushbacks we get on the cyber insurance side is, hey, we pass it on to a third party. We pass our data, we pass our backups, we pass our credit cards on to third parties all the time. Well, at the end of the day, if that third party's breached, so that supplier has an event, you could become legally liable for that as well because you were the one that passed it on. So we do a couple things inside of a cyber policy if it's well structured. One, we're going to pick up that loss for any ramifications that come against you. But two, say you can't work at 100% because that third party went down. A good cyber policy is also going to pick up what we call contingent coverage, get you back up and running, find a different resource, or pick up that lost income you may suffer.
Well, that's fantastic. Well, so the insurance sounds good. So how expensive is it, Alex? It sounds like it's a very rich policy. So what are the premiums going to look like for a practice like many that are on the call?
Yeah, so I don't think they're as expensive as what people think. Everything is going to be driven by revenue and the controls that you have in place. So, like we talk about intentional phishing, MFA, et cetera. But on average, we see these policies cost anywhere between 5 and 20 grand. So, as far as risk management insurance spend, very affordable, very similar to what we would see with a property or general liability policy.
That's good to hear. And obviously, you said this earlier. This is such a new area. I mean, certainly less than 15 years old. So every policy is almost a custom policy after you come in as the insurer and evaluate the current IT situation, et cetera. And right on cue, we have CEO of DKB Innovative, Keith Barthold, that joined us. He did a cybersecurity webinar back in December. So thank you for joining us, Keith. And please chime in with anything. Yeah, so Alex, thank you again for explaining all that. I guess what would be the first steps as we start to wrap up and open it up to questions, which, by the way, anyone listening, please feel free to raise your hand, to type something in chat. Julia and I are monitoring that. Text us, email us, because we want this to be very interactive. But I guess, Alex, as we wrap up our presentation portion, what is the next step for a practice? How do they interface with Hylant through USENT?
Yep. So I have 2 points here. One is to really know what a cyber policy can provide you. So when we talk about the expense factor, one thing I love about cyber policies is that it's not just an expensive piece of paper. A majority of the carriers that we've put in place through the USENT program also provide risk management tools. So whether you want to do a proactive scan or maybe get a reduced cost on intentional phishing, we've built this into the cost of premium dollars to make sure you can get a little more touch point than you do with a typical insurance policy. So as we start to walk through the process, as you get more interested in cyber, we've built a platform. What happens is you go to that specific link, and I know Julia will help us get to that point and show where we need to get there, how to get there. It's a limited amount of information we're going to ask for, handful of questions, business name, revenue, website, and then it will immediately start to pull up quotes. My team at Hylant will be notified on the back end. We will reach out directly to you and break down all the things that we talked about in today's webinar to show you where your best value is and where you're going to get the most coverage.
Thank you. Now, this was several people have asked me this, and this was even the topic of the panel that you guys were on back in October. So let's say you were in that company April 1st and you walked in and you saw that your computer wallpaper had changed and you know that your data had been hijacked. Who's the first call? Do you call your IT company? Do you call your insurer? Do you call the FBI? Who is your first call?
This
I know
this is
different
all.
people have different opinions, so Barthold, please weigh in here too.
Yep. So I'm going to give you a twofold answer. So my quick answer is the insurance company should always be the first call if you haven't been proactive and game plan for what your process is going to be. So if you have a managed service provider, if you have a security team that you vetted out with your insurance policy and that everyone has agreed and shaked hands to, then I would say your first call needs to be that security vendor because they know your network inside and out. They're going to be able to be proactive and the most engaged. If you haven't, we want to make sure that we engage your insurance company and also engage a breach coach to make sure that everything's protected by attorney-client privilege. And then we start getting the security in advance. Now, does that process take a while? No, it does not. If you need to call the insurance company and get that data breach coach engaged, we do it within hours, not days.
Yeah, you mentioned, and Keith, please weigh in, but you mentioned that attorney-client privilege. So when we talk about mitigating fines and mitigating civil litigation, it's very important to get legal involved ASAP, right? That's generally true, no matter what kind of bad act you've committed. So can you talk a little bit more about that again? And I don't know if Lisa's still on or not, from a legal standpoint, but how quickly and what you want to discuss with legal to get that attorney-client privilege in place.
Yeah, so I don't want Lisa banging her desk as I try to venture into the world of legal, but we see a lot of claims on the insurance side go very bad because legal and breach coaches are not brought in when they should. And when we talk about risk recovery, it's the simple things of like letting our employees know what's going on. How do we do that? Letting our third parties go, or letting our third parties that we engage with on a day-to-day basis know what's going on. What can we tell them? What can't we tell them? And if we don't engage the breach coach in the right way, the fines and penalties continue to be assessed and really start to tally. So we want to engage the breach coach, the insurance company, and the IT team, security team all in a swift manner as quickly as possible.
Okay.
I'll chime in and just say, like, having your incident response plan documented and having that proactively established is really key, because if you think about the panic that will ensue in the midst of a security event,
Oh, yeah.
much better to have that and have that available, have your team trained up on it, have a printout of that and have it available to where you simply go down the list and then you're just following the process. And Alex hit it right on the head to have that attorney involved. We've been involved in and pulled into several security events and served as a incident response commander working with the FBI for recoveries. And I think that is like the main point, is that if you have a documented incident response plan that you have trained through, then you're just following step by step. You're not having to make it up as you go. And you make sure that there are no misses. And so I think engaging IT to really understand, like, what is the gravity of this? Is this a single user had their email compromised and
Right,
there's no
right.
EPHI there, versus my EHR was full compromised? You need to have your IT company or your in-house IT staff sort of determine how big an issue it
Yeah,
is, really
determine the scope. Yeah.
defining the event. But as soon as you define that event, then yeah, attorney and insurance, because insurance will then engage you with if you need PR, if you need breach coach, whoever the appropriate people are to
Yeah, Keith.
minimize reputation damage and minimize impact, was certainly guide you through if it's something that needs to be reported to OCR, at what point to engage law enforcement and the FBI. But between insurance and between your attorney, let them help you navigate that. That's their expertise.
And
Yes, and you brought up something really important. Sorry, Alex. Just having it documented seems like it's that much more defensible, right? That you, as an entity, a practice, a medical device company, whatever, you took every step you could. It seems like that would portend favorably for you later in any, fine evaluation or legal proceedings. Is that fair to say?
Yeah, and it just making it easier, because, like I said, the stress that is involved in this process in a security event is extreme, and you won't be thinking clearly, and neither will your staff be. I mean, that's been our observation in working some of these recoveries. And so to have a documented process ahead of time, it just is a lifesaver.
Yeah. Another question, a lot of people are, talking about the fact that the federal and state authorities are willing to fine us, but what are they doing to protect us? So I guess, can either of you speak to why this has become such a huge threat and why anywhere from 60 to 80% of entities have to pay the ransom? I guess, what is the FBI doing, and what does the future look like?
Well, I think the reason that cyber crime has become such a big boom was because there was so much low-hanging fruit out there. Up until the last couple years, and we can blame the insurance industry a little bit here, all I was asking for was business name and revenue, and I was going to give you 10 million in limits, no questions asked. Over the last couple of years, we've really started to develop a process for this, and we realized some basic controls like multi-factor authentication or email filtering were just not there. So these bad actors were able to take advantage of it and make a really good lifestyle because this is their full-time job from 8 to 5
Yeah,
is
they know
hacking
the laws. I
companies.
mean, as evidenced by the message that this company received. I mean, they were lawyers. I mean, they knew all the fines and everything as it was going to unfold, and scared these poor people to death. So, good points. Any other questions? We're watching the time closely. We know people are in the middle of their work days, but this is such an important topic. Uh, um, One question was, can we again just talk about how Hylant, for example, would work with DKB Innovative or Practices IT, um, during that audit, if you will, to figure out coverage and to figure out pricing?
Yep. So we have a full-on workflow that we do with every single client, whether you're publicly traded or all the way to a nonprofit. So what we really do is want you to understand the controls that you have in place today, where those gaps potentially are. So when you fill out that information on the landing page, we're going to get that, we're going to vet that, we're going to provide you a blueprint of how you could enhance that, or maybe some things down the road that you could start to proactively look at. Once we get through that process, we'll look at the different options and terms that the pre-approved carriers have provided us, and we'll walk you through the advantages of each one, all the way from ransomware, business interruption, to the pricing, making sure you know exactly what you're going to get. Once we put that policy in place, then we also go and provide you those data breach attorneys, those forensic experts that are included in the policy. So like Keith talked about, you can really start to game plan and put that incident response plan in place, know who to call, when to call, and like our team's example, how to call and engage them.
So, do you have, when Hylant comes in and insures a practice, do you mandate who legal counsel is and or IT, or do you have a variety of other potential partners? Is that
Yep.
up to the practice, or is that up to you? I guess is my
Yep.
question.
It's up to the practice. We will help talk through that as closely as they would like. Each carrier has their own preferred set of vendors. So after a breach occurs, who they recommend going with, but that's typically pretty open with a number of different options. So you can pre-vet and really get comfortable with a firm.
That's great. Okay, team, any other questions? I think we're all appropriately scared again, just like when Keith did this talk back in December. But that's good. That motivates us to tidy up our fences, our electronic fences, for sure. Well, thank you, Alex, for the wealth of information. Keith, thank you for dialing in for a few minutes as well. Lisa, thank you for listening in from a legal perspective. Um, Again, I think it's imperative that each practice evaluates their current coverage and puts everything possible in place to prevent a breach. So please feel free to contact us. Julia has the process dialed in to have this audit done by Hylant, has the contact information for DKB Innovative, our sole source for IT solutions in throughout the entire practice, not just cybersecurity, but for everything. And we'd love for you guys to interface with both of them. Thanks
I'd say
everybody for the time.
I would say
Yeah.
this too. If we talk about this incident response plan, if you need templates, if you need guidance through that, just reach out to Julia and she can connect you with DKB. We have templates for this. Certainly if we're available for a consulting engagement to help out, but even less than that, if you just need a template and some guidance that we can offer up and provide through Julia, we can get you started with a plan.
That's
And
very
it
generous.
doesn't
That's
cost
great.
anything.
Thank you, Keith.
Sure.
All right, guys. Well, everyone have a great Tuesday. Good seeing you. And we should have another one of these supplier spotlights in the next 3 or 4 weeks. Talk to everybody soon. Take care.
Thank you.
Bye-bye.